So for the next medical condition of the ovaries, which we'll be looking at, this is what is known as a premature ovarian insufficiency, or most people know it as what? Premature ovarian failure. Okay, so from how we call this, you might actually want to now do some one or two thinkings, like, okay, premature, before time, ovarian is ovary, insufficiency is something that is not enough. Okay, so you just have to do it. It's a condition where the ovaries stop functioning properly before the age of 40, right? At least by 40 is permitted to stop functioning properly because you are approaching menopause. But once it is before 40, that's premature. It's also called what? Primary ovarian insufficiency or premature ovarian failure. Still the same thing. Alright, so what happens in this? The ovaries are producing lower levels of estrogen, right? And may even stop releasing eggs, right? Maybe not releasing regularly or totally stop. Okay, so this leads to irregular or absent periods, often infertility too. Okay, so unlike menopause, some women with this may still ovulate occasionally or even become pregnant. But this kind of pregnancy now, you can't even trace the woman's period and be sure that, okay, an egg will be released. Do you understand? So it's harder to get pregnant though. Alright, so common symptoms is what? Missed irregular periods. A menstruation cycle, you can't really say, okay, this will be this. So hot flashes, night sweat, vaginal dryness. Okay. Mood changes like anxiety, she's depressed, difficulties concentrating or memory issues, decreased libido, she's not really interested in anything sex again. Alright, so causes could be genetic issues, Turner syndrome, fragile X prematuration, autoimmune disorders like thyroid disease, Addison's disease. Maybe she's undergoing chemotherapy or radiation therapy, so the side effect of those drugs, right, causes all of that. Then surgical removal of ovaries. So sometimes it could be that you're having this issue because your ovaries have been removed. Okay. Then environmental toxins, like probably she smokes, she's been exposed to pesticides. Sometimes the cause is unknown. How can we diagnose this? So first of all, you might want to actually check follicle-stimulating hormone levels. Alright, then test for estradiol, thyroid function, genetic markers. Then bone density scans, because you want to now access that, okay, this woman is not heading towards osteoporosis, because estrogen is needed for bone strength in women. Then, alright, so how about the treatment options? Treatment options, you are identifying the hormones that their levels are basically low. You are trying to replace it. Psychological support for emotional well-being. Lifestyle changes, like you start eating good food, food that contain calcium, vitamin D, avoid smoking, right? And fertility support, okay, like all of that.